Welcome. What are the common problems to look out for week by week? No baby gets through the first 3 weeks of life without one or two problems cropping up that you may need to discuss with your midwife or doctor. So it's good to know what kind of complications your baby might run into during these first few weeks. What do I need to look out for in week 0? Jaundice. Jaundice is caused by a build-up of a substance known as bilirubin in an infant's blood. Jaundice will typically begin 24 hours after birth, peak on day 3 and fade by day 10. The signs of jaundice include yellowing of your baby's skin and the whites of their eyes. Around 60 in 100 babies will experience neonatal jaundice, which a midwife or doctor will monitor, although it's generally harmless. The treatment involves lots of feeding every 2 to 3 hours and sometimes spent beside a sunny window. If jaundice doesn't clear up, your midwife will likely suggest a checkup and a blood test. In severe cases, babies are treated in hospital, sleeping under ultraviolet light to allow the bilirubin to pass through the body. If the jaundice appears before your baby is 24 hours old, call your midwife immediately as your baby may need urgent treatment. Dehydration. It's possible for babies to become dehydrated in their first week if a parent hasn't noticed their baby not feeding properly. This could be caused by a problem with their latching onto the breast or simply not feeding enough. Look out for dry nappies and a sunken fontanelle, which is the non-bony area on the top of your baby's head. If the dehydration is severe, they'll lose 10% of their body weight, have dry lips, and be too tired to feed. If you're worried about dehydration, speak to a medical professional immediately. As a side note, some babies become very docile in their first week and won't demand food, so make sure to feed at least once every 3 hours during the day and once every 4 hours at night. What to look out for in week 1? Noisy breathing. It's really quite normal for babies to snuffle and snort, especially during sleep. Though it may sound very odd and even alarming, try not to worry. They're just trying to clear up their nasal passages of mucus. Babies are also very susceptible to common colds, and these can be quite uncomfortable for them. Babies don't breathe through their mouths until they reach 6 months, and their noses can become blocked, given that they spend so much time on their back. So you should expect more crying and less sleep if they've caught a cold. Try placing a towel under their mattress at the head end to help the mucus drain into their stomachs rather than gather in their nasal passages. You can also use saline drops, 1 or 2 in each nostril, to help clear the passages before feeding. These can be used from birth. Colds can become serious if a baby is swallowing mucus and vomiting a great deal as a result. This can lead to them becoming dehydrated, so look out for signs and contact a medical professional if need be. If your baby is pulling faces and crying at feeds, they might be struggling to feed and breathe at the same time. So speak to a doctor or midwife, or they may struggle to breathe due to a congested nose or airways. Irregular breathing. Although it can sound a little scary for parents, it's actually very common for babies to have irregular breathing patterns. They may even hold their breath for as long as 10 seconds before starting again. However, if your baby holds their breath for more than 20 seconds, they should be assessed by a medical professional immediately. What to look out for in week 3? Reflux. Reflux is the vomiting up of milk that most babies will experience. If your baby is putting on weight and the vomiting doesn't seem to bother them, it's really nothing to worry about. If your baby vomits quite a lot, keep bibs and lots of muslins around for cleanups. Burping and winding, lots of small feeds, propping up your baby's mattress at the head, and holding them upright for 30 minutes after a feed can all help. Some babies have significant reflux. So if your baby isn't putting on enough weight, or their vomit is blood-stained, see a doctor. A medical professional will often offer advice and treatment that will help keep your baby safe. Reflux generally disappears completely by 12 months. What to look out for in week 4? Pyloric stenosis. This is a rare condition, but it can be quite serious. It can run in families and, curiously, more commonly affects firstborn male babies, although not exclusively. Pyloric stenosis is caused by the ring of muscle between the stomach and duodenum thickening and blocking the stomach's outlet. As a result, your baby's stomach fills with milk until eventually they throw up most of their feed, often called projectile vomiting, as the milk lands a few feet away from the baby. You will also notice infrequent bowel movements as well as poor weight gain. See a doctor quickly if you notice any of these signs. While pyloric stenosis sounds a little scary, know that it is entirely curable. So, to recap, there are a few things to look out for during your baby's first few weeks. We don't by any means want to scare you, but if you're aware of them and know what to look out for, you have a greater chance of keeping your baby healthy and safe. If you're at all nervous and don't know what to do, don't hesitate to call a doctor. If it appears to be an emergency, take your child to accident and emergency or call an ambulance. Trust yourself and your own common sense, and don't ignore your instinct. It will oftentimes be entirely right.